Hello, my name is Caidyn Bearfield, and I'm going to be talking about what depression is in the brain and how different medications can aid in treatment. The belief that depression is all in your head is very dangerous misinformation. Depression is a chemical imbalance in the brain that is very real. In your brain, there are millions of chemicals floating around constantly that affect mood, among other things. While no case of depression is exactly the same, a common factor in depression is a lack of serotonin. Serotonin and dopamine are the neurotransmitters that are generally considered to be the happy chemicals, but others play a role in depression, noticeably norepinephrine, an adrenal that plays a large role in stress. Although there aren't a fixed amount of neurotransmitters that you're given in a lifetime, neurotransmitters are the slowest thing that your body produces. This is why medicine can help. I will talk mostly about SSRIs as they are the most prevalent. SSRIs are selective serotonin reuptake inhibitors. It may seem counterintuitive to inhibit any serotonergic action, but what the medicine is doing is preventing the serotonin from being used up too quickly and thus not having access to enough of it to regulate mood. The action of SSRIs is to keep serotonin in the synaptic cleft, which is a space where two neurons are close enough to each other that they can communicate and cause a response in the body, which is the actual neurotransmission. A tiny electrical signal occurs and causes the serotonin to activate, so the positive effects of the serotonin can affect the body and depressive symptoms improve. The synapse and neurotransmission occur easily in neurotypical people without medication, and it is also worth noting that different disorders can cause various chemicals to have difficulty transmitting. Like I mentioned earlier, every case of depression is different because every brain is different, so there is not a fix-all for everyone. There are different classes of antidepressants that have different mechanisms of action on serotonin as well as influencing other chemicals like dopamine, norepinephrine, and GABA, and some even go as deep as on working of the molecules that contain these chemicals. Since everyone's brain functions differently and depression can be caused as a myriad of things, SSRIs are not the right fit for everyone. Often people with treatment-resistant depression or dual diagnoses, such as anxiety, are prescribed SNRIs, which focus on norepinephrine as well, or atypical antipsychotics that work on dopamine more and can also be used in conjunction with other medicine to aid depression with or without psychotic features. Tricyclic antidepressants and monoamine oxidase inhibitors were commonplace in the past but are generally not used today due to greater side effects and that there are better options available now. The brain is a fascinating organ, and it is not shameful to need help regulating yours. I think it is very important that all people, whether or not they are directly impacted, understand mental illness and legitimize it beyond the doctor's office. I'm a firm believer that empathy and understanding will make this world a better place, and I also think it is important for people on any medication to understand what is going into their body and why it is necessary, but I just chose to talk about antidepressants. I hope you enjoyed this video, and thank you so much for watching.